Health Canada has now approved Canada's first ever dual test kit for syphilis and HIV.
Is the world's fastest HIV and syphilis test, producing results in as little as 60 seconds. The test procedure is simple.
This kit from Lindsey Biolytical Laboratories is going to help reduce the surging syphilis rates across the country, and it could help reduce inequalities in our healthcare system. Dr. Sean Rourke is a scientist and researcher from St. Michael's Hospital. His research into the efficacy of dual test kits was key in this approval process. Dr. Rourke, good morning. Welcome to the studio.
Thanks for having me.
Let's start with this. It's called a multiplex HIV 1 and 2 syphilis antibody test. It doesn't really roll off your tongue. It is the fastest of its kind in North America, which makes it so exciting. It works on blood from fingertips, plasma, serum, and venous, whole blood. Is that correct? Yep. So why is it so important to have a kit that does both?
Well, we have a huge problem right now in Canada with HIV and syphilis. Numbers are going up. It's actually a tragic situation, and it's a public health crisis that we need to address. So we need this test to actually reach people and get them tested, get them connected to care.
What are the reasons the rates are going up?
The rates are going up for a lot of reasons. It's been going on for years. Numbers went from recently, a few years ago, 2017, 7 congenital syphilis cases to now, over 1,200% increase to 96 cases.
1,200% increase?
This is huge.
Yeah, so this is really important. How does early diagnosis then affect the treatment outlook for people who live with the diseases?
Well, it's treatable. Penicillin costs pennies. We need to get people connected to get tested and care. It's that simple.
What effect could then the availability of these kits? We've talked about the rates, but what about the availability of these kits can help those numbers? Just early diagnosis?
Right. So our health and public health system actually works for most people, but it doesn't work for everyone. Mm-hmm. This is a test that actually we can bring into the community. This is a test that we can actually deploy, bring to people where they need to get tested in ways that are going to work for them, in sometimes the comfort of their own home or with people that they trust, to get tested and make decisions about their health.
It is harder to get medical help, so it's better when it can come to people.
Exactly. That's the way we need to do this.
What more needs to be done to help this kind of testing close the gaps for healthcare in this country?
Well, again, our healthcare system works for most people, but for
it barely works for most people these days.
So there are challenges, but Indigenous First Nations communities in particular, congenital syphilis is at high rates in these communities, and our Western system for healthcare doesn't always work for them, and so we need to be very sensitive to that. This goes way back. We need to build better systems to help them in their community get the testing that they need and access to the care that they need as well.
What excites you about this? Because, we used to think of testing. You'd go in, you'd get an appointment, you would wait, you'd have things taken, you'd wait for results. Like, you've got things in 2 packages here that are smaller than Kleenex.
Right. So this is the first test that was approved in Canada, November 2020. It's for HIV. It's a self-test. You can do it at home. This is the test that was just approved. It tests for both. It takes a minute. Highly accurate test that people can then make decisions about both if they have positive for HIV or syphilis and get treatment that they need and get connected to care.
So then what happens if somebody takes these tests and they're positive? What's the next step?
The next step is actually to see a doctor, get confirmation of those results because they're point-of-care tests, and talk about treatment options and getting connected. Again, these are tests that actually get people connected in the care system. It's not the panacea for everything, but it's a way of really establishing that connection, because most of the people that we're trying to reach, they're not coming forward, right? And we're trying to get them better connected. And so this is a way of bringing them back into the healthcare system and designing it for them.
There's less fear and less stigma when you can test yourself at home.
Exactly.
It's great to have you here. Thanks so much. Congratulations.
Pleasure. Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.